egregious, outrageous, shocking, inexcusable. Those are just a few words to describe this story that I'm going to tell you about. This is a story about a very big medical error that occurred in Florida just last month. Last month, August 21st, 2024, a gentleman named William Bryan and his wife Beverly lived in Alabama, and they traveled to Florida for vacation and to check on their rental home. While there, he developed some upper left quadrant pain. Now, I'm pointing to my left here of where it would be, but I do realize that often things are switched. But his pain was here. We're talking left upper quadrant flank pain. This is my left. And the reason I'm telling you that is because the reason I'm pointing out left upper quadrant flank pain is because it's important to know that on the other side, now I'm pointing to my right side, although it might be turned around for you, but this is where our liver is. This is where our spleen is. Okay, so Mr. Bryan comes in to the emergency room of Ascension Sacred Heart Emerald Coast Hospital in Florida with this left flank pain. And he has CT, different imaging done, labs done. A general surgeon is called to assess him, not a trauma surgeon, a general surgeon. General surgeon is Dr. Thomas Shaknovsky. So this physician is a general surgeon who felt that Mr. Bryan needed to have surgery and needed to have his spleen removed because what he felt he was seeing in the imaging was a enlarged and actively bleeding spleen with other maybe questionable, unidentifiable things. So he felt that that was the thing to do and in the best interest for this patient. But the thing is Mr. Bryan sat in the hospital there for a few days. And during that time, nothing else was done. For example, when I say nothing else, I'm not saying he didn't get IV fluids or pain management or something. What I'm talking about is he did not get active treatment for this questionable bleeding spleen. So what I mean by that is maybe stenting it, or what other people have said, like, what about a coil? What about clamping? What about stopping this bleeding? Why wasn't maybe that tried during the 3 days? And before he went into the operating room. And it's also important to know that Mr. Bryan wanted to go home. This is also really important. He did not want to be there getting surgery at this Florida hospital. He wanted to go where he felt most comfortable. A transfer to his home was not arranged to another hospital, transfer hospital, because apparently the surgeon at Sacred Heart Emerald Coast Hospital convinced Mr. Bryan that that would be perhaps too dangerous, and it really is the best thing to have the surgery done here. Now, you're going to hear two different sides the more you dig around in this, and if you look at Reddit or you look at X, wow, that's where a lot of different sides are. Like when I watched the two surgeons, one's a trauma surgeon and the other is a hospitalist, not a surgeon, but he's a hospitalist. And so when I listened to them a few days ago talk about this, especially the trauma surgeon, in his view, there is absolutely no excuse. His anatomy was mixed up. There's no reason that this should have, how could it have happened? And he explains exactly why, as a surgeon, why this, there's just no way. Something's wrong here. Not just the field was so bloody and messed up and I did my best and just a little oopsie. Something's really wrong here. But then if you go on Reddit or you go on X, you're going to see radiologists, OR techs, surgeons, other doctors giving their opinion, and even other surgeons who've done this kind of surgery like splenectomies saying, let's just give him the benefit of the doubt. We really don't know the whole story. But then others come on and say there should be no other story because he took out the wrong organ and the patient died. Mixing up hepatic or liver veins and a portal compared to, say, spleen anatomy. These are identifiable markers. I'm not a surgeon. This is what they're saying, and this is what they're explaining, that there's no way to mix this up. Okay, so Mr. Bryan goes back for surgery. does not want to go back, does not want to have this. You can sign out AMA, against medical advice. So remember that. This is not prison. You have things to think about. But I'll talk in a few minutes about how could this have maybe been prevented or maybe not. Because as many surgeons also speak up and say, accidents happen, bad things happen, much less than they used to because there are things in place. But these things can still, bad things, bad outcomes can still happen. Okay, so Mr. Bryan goes back to the OR, and who's back with him? It says in the OR report, apparently, that there's 2 people listed as anesthesia team. There is a scrub tech, and there is this surgeon. He's a general surgeon. All right, so no other surgeon, no other assistant. So I don't know, but that's all that has been spoken about, is that he did this surgery by himself. A second set of eyes is probably a good thing. So what happened is, during this surgery, the surgeon started doing it laparoscopically, and those are just the small incisions where instruments go in, but then had to convert to open, to a bigger incision. He then proceeds to take out the liver, thinking that it's the spleen, but we can't live without a liver. He lost 5,500 estimated milliliters of blood loss for this surgery, and yet there's about approximately 5,000 milliliters of blood in our body. He died immediately, but then the other interesting and sad situation here is that the surgeon then put the organ into the bag for pathology labeled spleen. That pathology bag, everything goes to pathology that comes out of the body. Your tonsils, your appendix, tissue, small, big, everything goes to pathology. So it gets there, and it was the pathology report that I will put up here that's got leaked and going around. OR report got leaked and going around too. Not imaging that I could see at this time. But the pathologist probably was really surprised to see that this was not what was labeled spleen, or the paperwork coming in says splenectomy, 70-year-old gentleman. Here's his name, here's the information, this is his spleen. But instead it was the liver. So the size of the liver and the size of the spleen are very different. The color of the liver and the color of the spleen are very different. How did this happen? How did this happen? So when you read what other surgeons are saying about this, like I said at the beginning, the surgeons are not very empathetic. They're saying this should not have happened. There are so many landmarks. This is inexcusable, period. Other people are saying this is just estimation of him. Did this surgeon have some trouble with, is he having trouble with dementia? Does the surgeon have some other medical condition that has caused him to have this type of confusion? Did he just plain forget his anatomy? If he did, why? What happened? Because last year in 2023, he also made a very bad error. It did not result in the death of a patient, but he made an error. Makes you wonder what's going on with the whole medical system, or the system of this Ascension Sacred Heart system. Why are they not maybe putting some things in place to watch the surgeon, or discuss some things with the surgeon so that he doesn't do more surgery? So he just does another surgery, and this is egregious, and this patient has died. Just for reference, so the average adult size of a liver is 3 pounds or 1.5 kilograms. That's average, although this gentleman was large, and perhaps his baseline was bigger. That's just average. Pathology report states the liver was 2 grams. 2-gram liver came to pathology in the size of 23 by 18 by 11 centimeters. Well, how big is an average adult man's liver? 14.5 centimeters. Spleen, much smaller. So back to what I was saying, what are some of these surgeons thinking? They're thinking he might be impaired. How else could this happen? You read comments, they say, what did he take? What confused him? Was he on medication? Did he have a bad reaction? Does he have, early stage dementia? Was he drunk? People are questioning a lot of things, like how could this happen? But then those that are kind of giving him the benefit of the doubt, think, well, he probably just got confused. I want to note that Dr. Thomas Shaknovsky's license last year, when he made a big error, did not get revoked. This time he made this big error, and as of the time, several days, as of last week anyway, his medical license is still active. Do you think that it shouldn't be? I think it shouldn't be. It is. They said that an investigation is going on, so at this time his license is active. That's his name. So, if you go to that hospital, which I don't know, this hospital could be just wonderful. It was the surgeon, it wasn't the hospital. But the hospital is showing a failure, a systemic failure, in that this kind of error can happen, or the one last year can happen, and there was nothing put in place to stop another big error from happening in the operating room. Some surgeons say, again, that he maybe just misidentified his landmarks, but trauma surgeons and general surgeons say this is basic anatomy. There's no misidentifying your landmark. Wow, this is really tough. How do we prevent something like this? It's such a big thing that it really is the whole system-wide issue of the hospital, not just that surgeon, because maybe things should have been caught sooner. Is it because in the OR people are afraid to speak up? Is it because the surgeon gives off a vibe, or has in the past not allowed people to speak up? But we all know we're supposed to speak up. When you are a medical person and you see something is wrong, you are obligated to speak up. That is drilled into us. That's like a given. Did everybody really not see anything was going on in the operating room? Did they really see that a different organ was coming out? Then did they really not see that it was put in the bag labeled spleen, that it was actually not the spleen? I mean, I realize not very many people were in the operating room with him, but all those failures occurred too. Besides systemic-wide issues that have to be addressed starting from the top, and then there are those that don't speak up down here while things are going on. I'm thinking, what could we do for this patient? What if it was me? What would I do? Well, and I really wanted to go home. So this patient really wanted to go home. Would it have been okay to transfer him? If a patient really has a gut feeling that something isn't right and they want to go, or they want a different surgeon, or they're not trusting something that was said to them that doesn't feel right, for me, I know I would ask for another opinion. You can ask for another opinion from there's other surgeons, there's other hospitals to get transferred to. You can request these things. And I realize the topic of insurance and money is always there. It's secondary to me only because life is first and then money I'll deal with later. But I really understand that, though, and it makes me sad because a lot of people don't even use an ambulance when they should, because they initially say, I can't afford it. Or in my other video when I talked about palliative care versus hospice, I'm not going to get either one of those things for myself or my loved one because we can't afford it. I wish somehow things would change where the importance and value of the human life and their feelings and needs is a little more important than always worrying about that money piece. There has to be better assistance for people to pay those bills if they have no insurance, or get them hooked into state insurance if they're eligible, assist them. But anyway, okay, I'm getting off topic. Could he have been transferred? Could they have done clamping or stopped the bleeding in those 3 days that he was just at the hospital before he even went to surgery? Could it be that another surgeon would come in, that this person who was going to perform surgery, who did perform surgery, did he feel out of his element? I guess he didn't. Maybe he was out of his element, but he sees himself as being a liver surgeon, a superior surgeon, a trauma surgeon. I can deal with this, all this mess in here. I can handle it, and I can handle it completely by myself. That's what I would ask for. I don't feel right being here. Can you just transfer me to another hospital? I want another opinion. Before you go in and do surgery, is there another option that we could try? If I was too unwell, I would ask my husband or my sister, could you look up a really good review on another hospital? I don't know, that is grasping, and we're looking hindsight, but those are just a few things that come to my mind. And again, this is just a horrible, terrible, catastrophic mistake that ended in the death of a patient. And are there ways to have prevented it? I'm going to list the surgeons that I watch, and the trauma surgeon that pick this thing apart, I'm going to list them below because they can explain it a little better. That's their specialty. And it's very interesting to learn about this and to learn about maybe some possibilities on what we can all do differently. Lastly, the pathology report and what I heard from the other surgeons that I watched is that the spleen had a small cyst, that this wasn't a necessary surgery. It wasn't as urgent, perhaps, as this surgeon thought it was. And that's a shame, too. If you like this kind of content, medical stories, health tips, things that feed our mind, body, and soul, positive, and other types of medical things that we can all learn from that maybe aren't so positive like this, please share. Please consider subscribing. Have a good day.